We have been talking about autoimmune hemolytic anemia for a while. And you know there are two different types of immune hemolytic anemia. We have the warm subtype and the cold subtype. Direct Coombs test is diagnostic to both the warm and the cold subtypes. So let's get started. So what's our goal? Our goal is to detect antibodies bound to the red blood cell surface. So this is a difference between direct and indirect Coombs test. Direct test detects antibodies on the red blood cell surface. Indirect test detects antibodies in the plasma. So here are the steps. We get some nice red blood cells from where? From the patient. So these are the patient red blood cells. These are covered with antibodies, and these antibodies are contacting the antigens. Then we add something called Coombs reagent, which is antibodies to human globulin. Could be against IgG, against IgM, or the complement. If they agglutinate, that's a positive test. That's a positive direct Coombs test, and it's diagnostic of hemolytic anemia, both the warm and the cold subtype. Please note, after we agglutinate the test, then we can do something else. The antibody can be eluted from the red cell surface and tested against a panel to determine what type was it. Was it IgG, IgM, or a complement? Okay, please note that direct Coombs test can be negative in the presence of brisk or fast hemolysis. If the hemolysis occurs rapidly, maybe the Coombs test will be negative in the beginning. Also, note that about 10% of warm autoimmune hemolytic anemia patients are Coombs test negative. So just because you have warm autoimmune hemolytic anemia doesn't necessarily mean that the Coombs test will come back positive. It can come back negative in 10% of the patients, or if the hemolysis is rapid in the beginning. Okay, why do we use direct Coombs test? We use direct Coombs test in many scenarios, such as to diagnose autoimmune hemolytic anemia, as you know. Also hemolytic disease of the newborn, as well as transfusion reactions. That's it for the direct Coombs test. See you next video when we'll discuss the indirect Coombs test. Thank you. How's life, everybody? I hope you're doing fine. In the previous video we have talked about the direct Coombs test. Now let's talk about the indirect Coombs test, also known as indirect antiglobulin test, or IAT. Unlike the direct Coombs test, where we were looking for antibodies on the surface of RBCs, here in the indirect Coombs test we are searching for antibodies floating in the serum, in the plasma, unbound to the red blood cells. So our goal is to detect antibodies in the plasma, and the steps here are more than the steps of the direct Coombs test. We start with the patient's plasma because we are looking for antibodies in the plasma. Then we add prepared RBCs of known antigenicity, red blood cells of antigens that we know, unlike these antibodies which we do not know. So when they go together, they will form antigen-antibody complex on the surface of the red blood cell. Then we add the Coombs reagents, which are antibodies to human globulin. They will form red cell agglutination. This clumping is visual in the test tube. When clumping occurs, it's a positive test. When it doesn't occur, it's a negative test. So that's fine. Why use indirect Coombs test? We use indirect Coombs test in the process of cross-matching before giving blood to a patient. So, antibody screening in pre-transfusion testing. That's number one. Number two is to screen pregnant women for antibodies that can cause hemolytic disease of the newborn. So, first, to screen in pre-transfusion settings. Second, to screen pregnant women for hemolytic disease of the newborn. That's the indirect Coombs test. I'll see you in the next video. Please stay safe and study hard.